How to get rid of cellulite. Why treat a side effect when you can prevent it? Exercise smart. Get moving. It's one of the best treatments. It won't make your cellulite disappear, but strong muscles under lumpy areas can make your skin look more even. Try a 3-part plan: a healthy diet, brisk exercise, and moves that tone your muscles. Regular exercise may help reduce cellulite, though there is no guarantee that it will be effective. Even if exercises do not successfully reduce cellulite, regular vigorous exercise may benefit both body composition and mood. As a result, it may help a person feel more confident about their body. Eat more raw foods. Eat more fibers, in whole grains, fruit, and vegetables, instead of empty, calorie foods. The simple or refined carbs found in many breads, candy, and soft drinks add calories. This leads to fat, especially in cellulite-prone areas. Lose a few pounds. Skinny or plump, you can have cellulite. But extra weight often makes it more visible. If you're overweight, the best remedy is to shed a few pounds. Try to lose weight slowly. If you've lost a lot of weight, it might show up in areas where your skin is loose. Kick the habit. Every puff affects the blood supply to your skin. Skin gets thinner and more likely to sag. This makes the cellulite on your arms, thighs, and bottom more visible. Massage the dimpled zone. Take a few extra minutes every day to give these spots a firm rubdown. Massage improves blood flow and gets rid of excess fluid, which may make dimples less noticeable for a while. Add retinol cream to your routine. It won't cure cellulite, nothing does. But it can improve your skin's look and texture. A product with 0.3% retinol is best. You need to use it for at least 6 months to see effects. It should thicken your skin's outer layer to help cover bumpy areas underneath. Note: none of the topical formulations currently available and utilized for the treatment of cellulite are approved by the United States Food and Drug Administration, FDA. Step out in support stockings. Modern support hose don't look like those thick, saggy things your granny wore. If you wear them often, your skin should look smoother because they help prevent cellulite from storing fluid. Cellulite treatments: what really works? Best results according to research studies. Acoustic wave therapy is a treatment that can be used to treat cellulite and to reshape the body. It stimulates the breakdown of fat cells, a process known as lipolysis, the production of new collagen, and lymphatic drainage. Acoustic energy is delivered to the targeted area, which then creates heat and stimulates the breakdown of fat, which is metabolized by the body, lymphatic drainage, and the formation of new collagen for improved skin tone and firmness. There is no real downtime associated with this treatment. 2 sessions per week are recommended, with up to 10 sessions advised for the best results. Several processes occur as a result of the treatment. Loss of fat cells, which are then naturally passed through the body. A boost to collagen and elastin production. The formation of strengthened connective tissue, so that the fat cannot slip through the tissue with a puckered appearance on the outside of the skin. Enhanced blood supply to that connective tissue so that it stays supple and dimple-free. Improved drainage within the lymphatic system, which helps to reduce edema. Advantages of acoustic wave therapy. Non-invasive. Probably the most critical benefit of AWT treatments is the fact that they are non-invasive. Unlike liposuction or any other surgical procedure, AWT does not require anesthesia, incisions, or downtime. Long-lasting results. Remarkable effects of AWT can last anywhere between several months into a year, varying on the individual's lifestyle and skin type. Safe and painless. Most of the time, AWT is well tolerated, and the patients say it feels like a light tapping or some kind of vibration. Suitable for all skin types, unlike some treatments, which may only be accessible for skin of a particular type or tone, AWT is safe for all skin types, making it relevant for a wide range of patient types in cellulite reduction. Final thoughts on acoustic wave therapy. Acoustic wave therapy has advanced cellulite treatments offered in the clinic, offering a non-invasive yet safe and effective solution. AWT stimulates an improvement in blood circulation, lymphatic drainage, and production of collagen at the very causes of the problem to produce much smoother, firmer skin. Versatility, long-lasting results, and high patient satisfaction make it ideal for the clinic seeking to offer the most advanced aesthetic solutions. Laser lipolysis. Laser lipolysis is a minimally invasive way of removing small localized fat deposits. It can effectively reduce areas of fat resistant to diet or exercise whilst reducing the risks associated with traditional procedures such as liposuction. A very thin cannula, 1 mm wide hollow metal tube, is pushed through a small incision in the skin. The laser probe is introduced into the cannula and laser light is then pulsed into the fatty tissue where the fat cells are transformed into an oily sludge-like substance or debris, which is eventually eliminated by the body, or sucked out at the time of the procedure. The length of the treatment depends on how many areas you're having treated, and whether or not suction is included, but generally the procedure takes between 1 and 2 hours. More often than not, one treatment session per area is considered to be enough, however it all depends on the amount of fat to be removed, and if it is felt that the final result, after 4 to 6 months, needs improving on or not. Endermologie. This treatment uses a device that gives you a deep massage while also lifting up your skin with a vacuum-like tool. The U.S. Food and Drug Administration, FDA, approved this as a medical device that has little potential to cause harm. The FDA, however, hasn't said that it works. People who offer endermology say that a number of treatment sessions are necessary to see results. Each session lasts about 45 minutes. Radiofrequency. This is a type of treatment that heats the cellulite. One FDA-approved device combines radiofrequency with a laser, suction, and massage in order to target cellulite. VelaSmooth and VelaShape. The VelaSmooth combined infrared and RF energy technology, plus tissue mobilization and suction, has proven to be an effective body contour and fat reduction tool, as well as cellulite reduction tool. The synergy of these three components, RF, VelaShape has 50 W of radiofrequency output compared to 20 W with the VelaSmooth, light, and tissue mobilization ensured that a depth of penetration beneath the skin layer is achieved for effective, controlled heating and claimed enhanced metabolism of fatty tissue. How does it work? The conducted RF increases oxygen intracellular diffusion by heating the adipose, fatty, tissue to a depth of 5 to 15 mm. The infrared light increases elasticity of skin and heats subcutaneous fat, beneath the skin, to a depth of up to 5 mm, while safeguarding the skin from damage, and the tissue mobilization, vacuum, manipulates and smooths out the skin to facilitate safe and efficient energy delivery. Tissue mobilization is facilitated by rotating, self-cleaning electrodes to ensure excellent coupling with the skin. Subcision. It is a surgical technique that severs the fibrous septal bands tethering the dermis to the subcutaneous adipose tissue. With the severing of the fibrous septa, biomechanical forces within the subcutaneous layer are redistributed, fat lobules are redistributed into spaces created by the procedure, and fat protrusion is mitigated, resulting in a smoothening of the skin surface. Called Cellfina, this medical procedure involves inserting a needle just under the skin to break up the tough bands beneath the skin that cause us to see cellulite. Subcision is recommended for cellulite depressions present at rest only and not for depressions that are visible with muscle contraction. Subcision can be performed manually or it can be vacuum-assisted or laser-assisted. More recent techniques include chemical subcision, using collagenase enzyme injections, and acoustic subcision, rapid acoustic pulse technology, Allergan Aesthetics, Irvine, California. FDA-approved manual subcision device. Avely is a new minimally invasive cellulite procedure developed at Skincare Physicians with Revell Aesthetics. It is a single treatment that is cleared by the FDA to reduce the appearance of cellulite on the buttocks and thighs. Unlike traditional cellulite treatments, Avely targets the septa bands beneath the skin. By releasing tension in these bands, Avely effectively smooths out the dimpled areas and improves your overall skin texture. Avely requires only a single in-office procedure to deliver long-lasting results.